Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to the episode today, which is the equine tongue and hyoid, a hidden key to posture. Can't believe we haven't actually talked about this yet. Hey Soph, how are you today?
Hey Raquel, I'm good. I know it's definitely been mentioned in other podcasts, but it's definitely time to do an episode just dedicated to this topic.
Yeah, it's such an important area for biomechanics of the horse and posture. It's something that I look at on every horse that I treat. And if you have a horse that's kind of struggling with their balance or their collection or even relaxation, sometimes the answer is in their mouth. And when we think about the mouth, we always think about the teeth. And now we more think about the bit, but that wasn't as much in the conversation previously. But yeah, thinking about the tongue health, and its relationship to the hyoid, which we're going to explain what that is. So yeah, how do you see, the role of the tongue, for example?
So the role of the tongue itself, like not in conjunction to the hyoid, is that firstly, it's very useful from day dot. It's needed for suckling, for foals. It creates a teat seal. As time goes on and the foal starts to eat normal food, the tongue is used to manipulate food inside the mouth. So it presses the food against the teeth and it moves it in a way that it mixes it with saliva and it forms a bolus, which is like a little bundle of food inside the mouth, which the tongue then pushes up to the back of the mouth and swallows in these little round or long oval shaped balls. It is also used for taste. So especially for salty and bitter foods, it's been used for, learning about herbs, what kind of foods to avoid, and also seeking out salt, which horses need a lot of, which we now understand very commonly. What about the hyoid?
Yeah, well, the hyoid suspends the larynx and pharynx, so it controls that movement of the tongue because of the way that it connects into the tongue. But it's also suspending. So when I talk about larynx and pharynx, that's like the area for air to go down into the lungs and for food to go down through that to the esophagus and get into the stomach. So for that to occur, the airway has to be kind of closed over by what's called the epiglottis to allow a food bolus to pass down the esophagus and not go into the airways. So it's really important for controlling that. It also supports the vocal cords and just supports kind of that general area. So where I'm always looking at it from a biomechanical function, but it's very functional for survival as well. And so that's its kind of, I guess, survival function, but we want to look at it from a biomechanics perspective. So when we're talking about the anatomy, so the bones in the hyoid, what are the bones that the hyoid comprises of?
The hyoid bones composed of the basihyoid, thyrohyoid, the ceratohyoid, the epihyoid, and the stylohyoid. And those little bones, they connect together in a U-shaped structure in the back of the throat. And like you were saying, they suspend the tongue and also the pharynx and larynx. And they are connected muscularly and fascially, which we'll go into. And there's such a huge impact because of those connections on posture, movement, and overall biomechanics.
Yeah, so The stylohyoid is the longer bone that connects up to the base of the ear. And so it's directly kind of below the ear canal. And so it's an important area to consider when we're doing anything with the ear. And this is why I hate ear twitches, which we're going to go into in a bit more detail, because you can damage that joint of the hyoid there. And also just create fascial restrictions through it. The stylohyoid then comes down into the epihyoid and ceratohyoid, then the thyrohyoid that connects onto the thyroid cartilage, which really creates that suspension there. And then the basihyoid has a lingual process that goes into the tongue. And so it looks like a chicken wishbone. And that's the shape of it. And the whole thing, to me, I always just think of a chicken, because it looks like the stylohyoid is like the wings and they're kind of up and flapping. So it always reminds me of a chicken, but it's those articulations are important for that tongue to be able to function in multiple directions. And just for, like you said, that swallowing of the bolus. So there's a number of what we call intrinsic muscles and extrinsic muscles. The intrinsic muscles kind of just support the hyoid in its position and support the tongue. So they're within the system of the hyoid and the tongue. So there's a number of muscles in the tongue and that connect both to the tongue and the hyoid. And, so there's what we call glossal muscles, which means tongue muscles. And then there's ones that are hyoid muscles that connect that. And then if we talk about the extrinsic muscles, because I think from a postural perspective, these ones are really important. So what are the extrinsic muscles?
So the extrinsic muscles connect between the hyoid bones and the other bones of the skeleton. So they're not just from the hyoid bone to a hyoid bone. And those include the sternohyoid, the sternothyrohyoid muscle, and also the omohyoid muscle. And that creates connections between the hyoid and the jaw, the hyoid and the sternum, and they're strongly influenced by the fascial connections that we're about to talk about. They're really direct muscles that link like your tongue to, the sternum and the rib cage. It's a really big unit, and it's a space that has to stretch and shorten and be very dynamic. So it's a space that can harness hold a lot of tension, and also be very strongly influenced by the way that the horse is moving.
Yeah, so I remember learning about the omohyoid years ago now in Sharon May Davis dissections. And now it's an area that I point out when I do the dissections as well. And so it goes from like the bottom of the hyoid. Sometimes you can see its attachment at the back of the basihyoid there. And then it runs down underneath the brachiocephalic, which is like the big neck muscle that covers the vertebrae. And then it comes out just in front and above the shoulder, and then goes in to the inner aspect of the scapula and shoulder, and it connects actually into fascia there. So this is the omohyoid. And then that fascial connection goes into the cutaneous trunci muscle, which is actually a fly twitch muscle. And then you can follow that back to the fascia around the stifle. So under dissection, we do a prac where we look at the influence of pressure on the tongue and the relationship to motion of the hind limb. So I have somebody moving the hind limb, and then I now just use my finger because I want to show the small amount of pressure on a horse that's not alive and how that influences the hind limb, let alone when a horse is alive and you have much more fluid connections happening. And so I place just a small amount of pressure on the tongue, and what we see is how the hind limb motion changes. And so it'll go from kind of smooth, quite a large looking stride, to like a stride that becomes kind of stopped at the end points of its motion. So it becomes like jilted in that motion. And what people are always surprised about is I then go around and show them the pressure that I put on the tongue, which is probably the pressure that you can put on your eyeball and still open your eye. And they're always surprised. And then without me even saying anything about the bit or their hands, that you can see their brains going, oh my gosh, like I put so much pressure on the tongue. How does that influence it? And I've also seen this happen like firsthand with a professional rider riding a horse. So they had a gag bit on the horse, and we're going to talk about how this can affect it. But they had a gag bit and it was on the second ring, so it creates a bit of leverage on the tongue and the pole. This horse could not go in a straight line, and it was jig jogging everywhere, and its stride length was really shortened. The professional rider got on, took it off the gag, put it onto the snaffle ring, and the horse, and obviously just better hands, the horse went perfectly straight. Its stride length increased by at least a foot, and it stopped jig jogging. So, we often think with horses where they're difficult to hold, we think about putting harsher bits on, stronger bits, but we really need to think about, function and comfort, because often the horse is just trying to communicate that they're actually uncomfortable, and often it's making it less pressure that stops the horse from pulling, and they're just pulling because it's uncomfortable, and they're trying to find a way to deal with that discomfort. So also, if you want to explain the ventral fascial lines, and how there's that connection there that we're having an influence on with head position and the bit as well.
Yeah, so the ventral fascial lines, there's two of them. There's a superficial ventral line and the deep ventral line, and they connect areas of the body with each other for biomechanical and fascial uses, basically, like resisting physics, motion, etc., and adding support. So the ventral fascial lines connect the hind foot. They travel through the patellar ligaments, through the pelvis, the hip joint, the abdominal muscles, especially the deep fascial line encompasses the visceral space, and they then travel up the neck and they connect into the hyoid. And so there's that very direct anatomical connection between the hip and the stifle, the hind foot, the abdominal muscles, the abdominal cavity, and the ventral neck right up into the hyoid. So it's everything that you were just talking about that you see with that gentle tongue pressure, even in a horse that has died and is laying recumbent on the table. You can still feel the tension that picks up in the fascia between all of those structures.
Yeah, and like as part of the viscera there, like you've got the diaphragm. And so that's, you've got connections directly to the diaphragm, let alone just it also relates to breathing because of that, the support of the larynx and pharynx. But also with the abdominal muscles in the pelvis, you've got the iliopsoas in there. And so we've got a fascial connection of the psoas to the hyoid, and that's just so important for a horse to be able to carry themselves in good posture. So we know if they've got a psoas issue, that's going to have an influence on what's happening, with the way that they deal with the bit and the bridle and things like that. So, everything is multi-directional, multi-dimensional, and so, when I'm treating a horse, I'm always going from back to front and all around, because it's like a puzzle that we're working out and going, okay, the hyoid's restricted, but is that a primary problem or is it a secondary problem and it's because of something else that's going on in the body? So for me, when I feel a hyoid and it feels great, I'm like, okay, this body's pretty balanced. Like there's, not too much to sort out here. But then when I feel a hyoid and like there's multi-directional layers of tension, I'm like, okay, this one's going to be a bit of a puzzle that we're going to have to work out. And then after, I've looked at the body and come back to the hyoid and go, okay, some of that's released, some of it hasn't. So for me, it's a really good indicator of the whole body function and how the body is being pulled in certain directions. Would you agree with that?
Definitely. I see it all the time, like just how influential the rest of the body is and how it goes in both directions. And it's such an unpicking to figure out where things are coming from. But the best
Oh, we just lost your sound. Oh, now you're back.
I'm back. Just everything that you were talking about, like assessing what areas are having the strongest impact and seeing how you can influence the horse for improvement and just aiming to improve function, really, all the time. And the hyoid having such an impact on the rest of the body means that it's such a great place to start and not always finish, but to include in an assessment before and after all kinds of body work, even before and after you ride, because it's a place that you can assess improvement, whether things haven't improved, if there's been a positive change or not. Even if sometimes you haven't done anything to the hyoid, you see a massive change somewhere else, you come back and you're like, wow, there's been such an improvement in motion or comfort, or the horse leans into touch in that area where they wouldn't have before.
Yeah, and it's also important to note that the hyoid motion moves like a gyroscope. So it has like a multi-directional movement. So it has like side to side, up and down. It rotates, it kind of can move like basically every direction of motion. It's probably one of the few things in the body that can move in every direction of motion in the way that it's suspended, and that's why it's so influenced by how the rest of the body posture and balance is. And sometimes it's hard for me to even describe the restriction in the hyoid because it's like pulling up here and over here and around here and so it's like it can be a really complex alteration in its position just because of how the rest of the body influences that. So we talked about kind of those body connections, but there's some more common causes of the tongue or the hyoid being restricted. So what kind of things have you kind of come across?
So the most direct things are going to be obviously the stuff that literally touches the tongue and the hyoid. So bit fit and rein tension, the amount of pressure that's going on the tongue, and that includes, bit fit, the size of the bit, the kind of bit that's being used, and also whether or not it's appropriate for that particular horse to have a bit. We'll go into scars, but I know you've seen horses, and so have I, that have very drastic influences on their tongue for reasons like scars, etc. Another thing that is tack related is noseband tension. There's a lot of information out there. Of course, there's been changes recently even to the regulatory
Amount of space.
the amount of space that can be left underneath the noseband and changes to the device that's used to assess the space in the noseband. And also there's more awareness developing as to how to appropriately measure noseband tension so that, in places like the Olympics or at FEI stuff or EA, they're actually testing by putting fingers or the device in the front of the noseband, not at the side, because the front is where you're supposed to, between the nasal bone and the noseband is where you're actually supposed to assess tension. And that's where you get a gauge of, whether there's enough space in the noseband using the device. Obviously, it's risky putting your fingers in there, but that's really important to note that there are cases where stewards or people assessing aren't taking those measurements correctly, and you can advocate for your own horse by checking your noseband by assessing whether or not you have enough space down the front of it and encouraging other people kindly with that information and to make the most of it.
Yeah, and I think, I mean, that's important in terms of horses not having their mouth jammed shut, but with a bit fit, which we'll come into when we talk about prevention, because you know, got to recognize that horses' tongues are different shapes, different sizes, and they fill the mouth in a different way. So not every horse has the same shape of mouth and the same shape of tongue. So that's where bits can have a very different influence on the tongue there. So some other causes of hyoid and tongue restrictions are like if there's things going on within the neck. So if they've got like arthritis or other reasons for tightness or tension in the neck, then that's going to influence specifically like the sternohyoid and the omohyoid muscles that connect to the sternum and the hyoid. Tongue injuries are a big one, and I now cringe if I see like people connecting lunge lines or other things to bits or tying horse up with a bit or leaving the reins loose, because I've now seen a number of horrific scars on tongues where one was, I reckon at the time, was nearly 50% or more severed. And another one, he had it on both sides. Henry, my thoroughbred, he has a scar from being tongue-tied, and a lot of it's mostly in the thoroughbred or standardbred industry, like the tongue ties, where they tie the tongue, they put a stocking or a tie around the tongue and then tie it to the lower jaw so they can't get their tongue over the bit. And for me, there's no excuse for that anymore, because we need to understand more about biomechanics. And if a horse is getting their tongue over the bit, there's a reason. So either the bit is uncomfortable or there's some other biomechanical restriction that's causing the tongue not to be able to be free in the mouth. So it could be a forelimb problem, a hindlimb problem, a back problem. Like there's something else going on in the horse that means that you need to tie that horse's tongue down, and we need to hold ourselves more accountable for figuring out the reason rather than tongue tying them. And if you've had a thoroughbred or a standardbred that's been tongue tied, then you need to address that, you know, before you kind of consider restarting them, like looking at their tongue health and their hyoid health. And yeah, checking tongues for injuries, because it will have a significant impact on your horse's biomechanics. What else?
So another thing that can have a direct influence is dental imbalance. That can come in the form of, you know, whether or not you have sharp points. So the horse's tongue is, you know, they're manipulating their tongue so that they can be more comfortable in their mouth. It can also have to do with the physical balance, you know, whether or not the teeth are aligned properly, both at the incisors and in the molars, and whether or not they are chewing properly, because the motion going through the hyoid, the tongue, and also the TMJ is going to be influenced by whether or not they're willing or able to use the proper motion of their mouth. There's also global body tension and alignment. So, you know, all the things that we talked about in the fascial connections, everything from the diaphragm, abdomina, psoas muscles, hips, stifle, hind leg, neck, etc. All of those spaces, if you have an issue there, it's also going to influence the hyoid. We touched on ear twitching, but it's a really big deal, particularly because while, you know, foals are really small, this is just another topic that I'm so passionate about, they often are not prepared for the things that we need to do to them very early in life. So if your foal gets an injury, they need their feet trimmed, all of a sudden they have a mini colic. If anything happens, often they need to be restrained, and what better way than something that will literally immobilize them and keep their handlers safe, which is very important, than to grab an ear twitch. And they're such tiny little ear muscles and the connection like straight down into the stylohyoid that you were talking about, the tension that's created there is huge with an ear twitch. And I've done plenty with foals in lots of situations, and I have even ear twitched myself. There's been times when I haven't seen any other option because of, really dramatic injuries or illness. Definitely not pointing fingers, but I do think that preparation of young horses and older horses for intervention, medical stuff, bandaging, hoof trimming, etc., is one of the best things that you can do to avoid ear twitching.
Yeah, and we've really got to do everything we can to avoid it. There are, trying to use any other form of restraint before we resort to it, because yeah, I've seen horses that have become so head shy due to being ear twitch, but also really painful around there, and then so restricted. And the other thing we've got to consider, I mean, we're talking about the tongue and the hyoid right now, but just between C1 and C2, you have direct access into the spinal cord. So creating that fascial tension through twitching the ear is going to affect that whole occipital atlanto region, so the pole region, which has connections directly into the fascia at the back of the brain, and the fascia through the brain, as well as the spinal cord. So there's just such a potential there to set up restrictions in the entire body. And it's really important that if they ever have had to be ear twitched, that they're then treated by somebody who's qualified, from a bodywork perspective, to release those fascial restrictions and make sure that the hyoid, the TMJ, the pole, the ear is all really comfortable. And another one there is wind-sucking collars. So there's a lot of variation in wind-sucking collars, and I've recently treated a horse with one who it's like one that it sits in front of the ear and behind the ear and then goes around. And he has scars from it. He has scars, I think there's scars over his kind of larynx throat area. And he constantly stood at the tie-ups and was like throwing his head up and down, up and down, up and down. And when I've touched over his occiput now, and his hyoid was completely restricted because he's a windsucker as well as the collar. But when I touched over the top of his occiput, he was just like, oh my God, don't touch it, don't touch it. But releasing that, he's just become a much calmer horse. So, for my windsucker, I don't put a collar on him because I did a bit of research about that, and recognize that in itself can be more stressful than sucking, but you've got to obviously weigh up the balance. And he takes a lot more feeding than my other horses, but I can maintain him with food, like with increased feeding. But if your horse is wearing a wind-sucking collar, you need to think about the fit and comfort of that collar, and B, determine any other stress factors to reduce that, and C, have them treated in that area often to make sure you're not setting up for restrictions that will affect them biomechanically. What else in terms of causes?
Well, there's head traumas, definitely. I've seen a couple of cases shared with x-rays where horses have actually fractured their hyoid, and there's been long-term head shaking, head tossing, and like head aversion behaviors that they couldn't figure out for years until they did x-rays. It's definitely something that you wouldn't know unless you had an x-ray, because there's so many things that could be going on with head shy behaviors, etc. But definitely head traumas are a big deal, and that also pulls into what we're saying with ear twitching. That in itself is a head trauma, definitely. And things like scars as well. What we were saying about the tongue, we've both seen scars. I've seen a couple of very fresh injuries, and it amazes me just how much the horse is forced to keep using the tongue regardless of how they feel about it, with eating and grazing, etc. I've actually seen a number of foals that have a parrot mouth,
Mm-hmm.
and listening to them suckle, like when you have a look underneath, they suck in a lot of air as well. And, I've opened the mouth of a couple that had a really severe overbite, like the top jaw was set really far forward, and the tongue was aligned with the lower jaw, not the top jaw. And trying to watch them, get a tongue seal on the teat, they were sucking a lot of air, they drooled a lot. There was just a lot of mouth tension. And I imagine that the effort of trying to constantly use your tongue in a space that it's not designed for would have a really strong impact on your ability to move, the food around in your mouth, etc., and trying to eat. So I think things like that should be, if you've got a foal and you discover they have a parrot mouth, being aware of that and knowing that maybe it's a limitation, and supporting them with, the things we're going to discuss through body work, etc., are really valuable for the tongue as well.
And one of those head traumas, so just jumping back to there, pullback is a big one that can cause hyoid restrictions, like as well as pole and temporomandibular joint. But yeah, if your horse has had and it doesn't even have to be that bad, to cause restrictions in that area. And another one is them getting their head stuck between something. So I had a horse that I treated that had her head stuck. And so she had scars right over her jaw, and it had caused some paralysis of her tongue. So she'd stand, and she had a facial nerve paralysis, so droopy lip, droopy eye, droopy face, but her tongue, she couldn't use it properly. And it happened 6 months before. And for her, it was actually good to treat because it was the scar tissue causing the pressure on the nerve. So releasing the scar tissue, a couple of treatments, and she could actually chew pretty normally, use her tongue pretty normally. But I've seen a few horses now that have chewing issues where you'd say, oh, like there's got to be a dental imbalance there. But and I put one on my page a couple of months ago, he would always have his ears back when he was eating, and he'd grab his food and come back up to eat. So he wouldn't eat with his head staying in the bowl, and then he'd drop his food everywhere, and he'd just be really cranky. He was actually generally really cranky. I could see tension where the omohyoid went into the shoulder. I could see tension around here, and there's a little funny little kind of scar there. And treating his hyoid, so he had 3 treatments focused on the hyoid, and he was chewing better. He stopped being grumpy around his food. He was able to stay eating in his bowl, didn't drop his food. His neck flexion has improved. And, I was like, there's no point me working on his hind end, even though it was restricted, because there was an obvious, like, painful dysfunction up here. So I could have worked on his hind end all day, but for him, the primary was up here. Whereas for other horses, the primary can, maybe in the psoas or something, and that's influencing that. So, yeah, it happens. Primary trauma to the hyoid, to the tongue happens. And so, now we're going to talk about how you might see it in the body. So with hyoid and tongue, and I guess you've got to recognize that with all of these potential ways that you can visualize it, there's so many things that could also cause these things. But it's understanding, how hyoid and TMJ could come into that. So some of the things that you've seen in relation to, like, when they've got a hyoid and tongue restriction, what other things have you seen that are altered?
So you mentioned earlier things like stride length, balance, etc., entire global biomechanics, but in particular, you might see, because of the direct anatomical connections, the sternum and shoulder position and motion. So those are connected, especially with thoracic sling and fall in motion. So you might see a lack of elasticity through the forelimb, and particularly a decrease in your ability to maybe do things like retraction stretches. So like bringing the forelimb backwards, like the toe backwards, as in towards the hind leg. Or the horse might, they won't leave their limb on the ground for quite as long, so they'll immediately bring it forward. You
Can I
might.
just jump in there? Because that
Mhm.
horse that I was just talking about with the really severe hyoid restriction, whenever she'd walk him over rocks, he looked like footsore. And so, you know, we, yeah, we were kind of like, oh, well, his feet mustn't be comfortable. But the interesting thing was that when his hyoid became comfortable, he was fine walking over rocks. So, whether that's just the fascial connections coming down from the hyoid, and then the rocks obviously had a different also proprioceptors. There's a lot of proprioceptors around the hyoid and the TMJ, but I would assume it's like the fascial connections and how they're altered when he would walk on the rocks. But yeah, it was really interesting with him how she was like, oh my God, he now doesn't worry about walking on the rocks. And he uh also with that sternum position. So when I've got a horse where I've kind of worked on everything and I still can't get the rocking, I feel for the pull, and I get some horses like what you said, where there's just this pulling the sternum up to the hyoid. And so even though, it can go back because the hind end is more comfortable or wither's more comfortable or whatever, sometimes they've just been stuck like this for whatever reason for so long that that sternohyoid has got so tight that they can't like get that sternum to go back. So it's a really good one when you're having trouble getting sternal motion to look at that connection.
That's interesting. I'm just imagining with the horse who didn't want to walk over rocks without tension, just the idea that the instant that you introduce a little of your own tension to control your motion, let's say as you land your feet, definitely, like how you see horses, um they'll use their muscles rather than just landing, and depending on the suspension of their ligaments, they'll control how they land on the ground. That you introduce a little bit of tension, and that pull immediately would be over exaggerated in a horse who already had a baseline to brace up. So you'd have a lot of pull
He was so
immediately.
sore in there
Yeah.
without motion. So let
Yeah.
alone like, yeah, adding in that fascial tension and motion. Yeah.
Yeah. We did also, so we discussed the fascial lines and the fact that there's a couple of fascial lines that connect to the area, including the forelimb protractor line, and it doesn't connect directly onto the hyoid, but because of the space is relative and there are deep connections between all muscles, etc., that's one area in particular you would see a lot of influence, that shoulder position, forelimb motion. What else do you see that stands out for TMJ and or hyoid and
Um,
tongue restriction?
Yeah, well, obviously the TMJ, temporomandibular joint, works in very close association. So if there's a hyoid restriction, the TMJ will be restricted and vice versa. Same with the pole. And you'll get kind of, sometimes I see horses where they're almost stuck with their pole in flexion. So they just don't have, and there can be other reasons for this, but they're not able to extend through the head and neck and open up the throat area. And so that can be because it's being pulled ventrally. It can be other things happening in the pole. But also with that horse I was talking about, like he couldn't bend through his neck. So his ability to laterally flex, and the owner said like she was getting rewarded in her dressage test because he sat in a position, and it was a nice looking position in terms of a dressage position. Um, but the reason he sat there was that was his only position. So he had this kind of little bit flex position that was quite a nice head carriage. But if you asked him to lift it, lower it, turn it, there was no ability to change it. And I joked with her the other day and I said, oh, I'm sorry, now you're gonna have to ride your horse because he's not gonna have a fixed head position anymore. You might not get so rewarded in the dressage test, but she's fine with that. But yeah, so he was very fixed in that position, which was, we want horses that have really good changeability in their head and neck, up, down, they don't just, set there and stay there. So that's a big one. And they can, a horse that's reluctant, that goes with a horse that's reluctant to stretch forward, or a horse that's resisting the bit. So I've got another one at the moment. She's only a 4-year-old, and they called me out because she's clunking in her jaw. But actually, no, that was part of it. The biggest reason was as soon as the owner picked up the bit, she's a nice mannered horse, and she just started to like resist on the bit, and she had a pullback. And my expectations of treatments are often high. I was like, okay, 4-year-old, one treatment should help her a lot. Well, it didn't. It made a difference, but it didn't like completely fix her because it's so complex in there. Like there's so many structures in the pole and the hyoid and the TMJ that she's still like, she's on her 3rd treatment today. We'll see what she's like, but yeah, that's an example of one pullback that created that resistance to the bit, and that's what the owner noticed to call me out. What else?
So, really connecting into the points you just made, neck, lateral flexion, and the ventral flexion. So everything you're just saying about being able to lengthen the head out and also bring it, bring it underneath, so the chin towards the sternum as well. There should be changeability in both directions. You should be able to bend it up rather than it just being like so tense that it doesn't actually have any ability to contract properly as well, like a set tension. Your pole tension and head carriage, that might be a place that you start seeing some tension as you were just describing. Your horse's balance, the comments you made earlier about the rider who changed from a gag bit onto a snaffle, that's another place. So you might think that your horse has straightness issues, but it's actually, you think, oh, I've got to manage them with my legs or my seat, but actually it's coming from the tongue and the hyoid. The reluctance to stretch forward, you might see resistance to the bit, so the head tossing or the immediate tucking behind the vertical with any level of bit pressure. You see relationship to the hind end. So if you're seeing your horse chronically has the short stride when you maybe have investigated other issues, or you are encouraging them to move freely and forward, then that might be something you ask your body worker to look at in your next session. You might also see an issue with transitions. So like particularly into the trot, I think from a walk is a big place you'll see it because of that jerk up into motion and the increase with the forelimbs. It's quite a point of suspension, with the forelimbs moving from a walk into a trot. What else do you think? Anything else that stands out?
No, I think that pretty much covers like common things that you'll see with it. People might ask, well, what do you do with it when you've found it? I've seen one horse that's had, so it, because you can get arthritis, which we didn't say as a pathology, but you can get arthritis in the tympanohyoid joint, so the joint between the base of the ear and the stylohyoid, and that can cause a lot of pain and dysfunction, especially when eating. And so sometimes they will disarticulate the hyoid at the serrato-hyoid, and so basically it means that there's not going to be that pressure on the stylohyoid. They used to actually fracture the stylohyoid and then just leave it in there to take the pressure off it. I think the disarticulation is a better option. However, it's going to influence the way that they eat and drink, and they're going to have to learn how to manage the movement of their tongue in a different way. But, really having a good body work and myofascial release, osteopath, chiropractic more from a TMJ neck perspective, but just not all body workers are familiar with working on the hyoid. Sometimes I'll get calls from other fellow professionals about it. Like it's not always an area that people are familiar with. So just asking your body worker, and it's an area you have to be very gentle with. I used to do a tongue stretch, like using the tongue, and it was effective. It was taught to me by Dr. Kerry Ridgway. It was effective. However, you can cause damage doing that if you don't know how to do it. And also they can bite on the side of their tongue, and I had a owner get their finger bitten, and so now I don't tend to do it. I can address it in other ways, and I can see how the tongue is moving to show me that improvement. So yeah, just making sure that whoever is working on your horse, they are familiar with working on that area, because it is a delicate area to work on. All right, so then we're just going to finish up with supporting a healthy tongue and hyoid function, and we've gone into a bit of it already, but we'll just kind of go over those things. So do you want to go through a few of those things?
Yeah, so that might include making sure that you've assessed your bit and bridle fit. So getting somebody who's qualified at that to help you out with your particular horse. That might include going bitless or bridleless, depending on your horse. Don't discredit it, because it could be something your horse needs. You mentioned avoiding connections to the bit, such as side reins and lunge lines. I don't love side reins ever, really. I think they're quite inappropriate for horses in terms of genuine self-carriage. But in especially this case, it's a lot of leverage on the tongue, avoiding tongue ties like we were talking about. Other ways to support the tongue and hyoid include regular dental care, having a qualified person come out, and there's growing information too about neuromuscular dentistry, which is very interesting, and the understanding of the motion of the mouth, especially the incisors. Really important to look at the incisors with dental care. You making sure that there's sedation with dental is really important. Having somebody who can get right in there with a mirror, and also just like having a really good motion of the jaw, while the horse is sedated, is very important. We talked about ear twitching, avoiding that as much as you possibly can in all circumstances. Wind sucking collars, the influence that the collar has both on the pole and the ones that push under the jaw on the hyoid, massive impact. What else do you think? How do you support healthy tongues and hyoids?
Hoof balance is really important too. So we haven't kind of touched on that a lot, but if there's an imbalance in the hooves, it's going to affect the whole body balance. And because of the way the hyoid is structured, it's going to influence its position. So definitely hoof balance and comfort. And as we just discussed, it can go both ways there. Regular body work sessions to just ensure overall balance of your horse, and obviously all the other maintenance things that go in with that, like saddle fit, etc. And then encouraging natural chewing and swallowing. So having variable feeding positions, which might vary in their height, their placement, the textures of the food, so hay versus hard feed versus grass. Some horses, like two of my horses, they don't have a lot of grass, so they're not getting that pulling action that a lot of horses do using their incisors in the same way. They're doing it out of hay nets, but it's different. So, thinking about how you can promote better grazing postures and variations in feeding positions, because horses in the wild have a lot of variation in how they eat. And we have done an episode on that in the podcast before, in episode 8 on feeding positions. The other thing I would say is just addressing posture, because through the equine functional posture course that we run, we have seen, well, we've actually had a number of dentists now, vet dentists, comment about the balance of the horse's teeth. So the horses that have been through the course continue to do the postural work. I had it personally with Jelly. I had the vet dentist say, gosh, he has such a balanced mouth. Like it's one of the best mouths I've ever seen. I've had it now with a couple of clients where they didn't even make the connection to the posture, but they told me, they're like, oh, my vet dentist came and said that my horse's mouth was like one of the most balanced mouths that they've seen. So addressing entire body postural function is integral for hyoid function. And obviously that goes both ways. But yeah, come and do the EFP course when the next one is running. And that's a great way to manage your horse's hyoid as well. Otherwise, can I just touch on bridleless for 1 second? So we're going to close out in a sec, but I ride Jelly bitless. I've ridden him bridleless as well. I think with bridleless, you've got to make sure that you're not having to put too much pressure on the neck, because that can actually cause restrictions in the hyoid. And with Jelly, I was riding him bridleless, which was lovely, but he was starting to resist a little bit the pressure on the base of his neck, and he just was pushing into it as opposed to lifting away from it. So I chose to go bitless, and as soon as I put the bitless bridle on him, even now when I put it on him, he closes his eyes and he's like, oh, I love this bridle. But one of the reasons I ride him bitless is because he has hind end issues, psoas issues, and lumbosacral issues. And so understanding the connection between the hind end and the tongue, I don't want to restrict his tongue and restrict his hind end any further. So for me, I choose to ride him bitless because A, he's comfortable, B, because he has hind end issues. So if your horse, and we haven't talked about hamstring scars and hyoid, because I also see a relationship with hind ends like going the other way. The hyoid gets restricted because of like hamstring scars or other scars in the hind end. So if your horse does have hind end dysfunction in itself, I would consider not riding them with a bit, to not add further restrictions into that hind limb. So, I don't just ride bitless for the sake of riding bitless. I'm doing it for the biomechanics of my horse. Whereas as my young horse comes along, maybe a bit will be more appropriate for her. Like, I don't know, but it will be fitted. So just think about that. It's not for everyone, but that's why I personally do it.
Definitely.
All right. But yeah, if you want to just close out a bit of a summary and then.
Well, I think the whole gist of the podcast this episode has been that this is a very small structure with quite a profound impact. There's not many parts of the body we didn't say have, a connection to the hyoid, and the way that it is influenced is just huge. So if you can at least pay attention to the hyoid, have a look in your horse's mouth if they'll let you, see if you have a tongue scar that's hiding. I know I've had a couple of clients be like, I didn't know that was there. It's important, and also being able to speak with your body worker or your dentist, etc., or even your farrier about hoof balance, your team, and just see whether or not there's any chance that you could have a positive impact on your horse by seeing if there's tension in the hyoid or the tongue that you can help them with.
Yep, and just keep addressing the whole body in its function, especially looking at optimizing the horse's posture. So yeah, thank you for joining myself, Dr. Raquel Butler, and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so that we can continue to share more valuable insights.
And we'll see you in the next exciting episode.